We have a couple more minutes till noon, so I've turned everything on, and we're just going to kind of hang out and wait for people to join us. So if you have any questions or you've already thought about something, you can always use that chat feature and write it down to get started. Otherwise, we'll just hang out for a couple more minutes, and then we'll get going. So it's right at noon, and I'd like to give people just a minute or so to get started. And I'm so happy that you guys are joining us. This is probably our biggest registration we've had so far. And honestly, I think it's because it's, write the word weight loss in anything and everybody comes. And that's just the way it's always been. And I get that. So this is something we are really excited about at Desert Wellness, using the peptides, especially semaglutide. So we will give everybody just another minute or two to jump in. I can tell by how many people are jumping in, and so we'll wait just a couple more minutes. But anyway, if you have a comment or a question to start out, you can write it into the chat feature. And as we go, you can always write things down, and we will answer most all your questions. And if there's some we can't get to, then we can always pick up with you afterwards. And also, if you have friends that wanted to come today but couldn't, registering for the webinar gives you the opportunity to get the link faster than waiting for it to come out to you. So if they couldn't attend, you could text them real quick and see if they can register. And if it's too late, that's fine. But the link will be available to people that didn't register in the next week or so on YouTube. We'll make sure you know how to get that too, because you'll be probably telling people and they'll be like, well, I want to know more about that. And you can send them to the link. Oh, Andrew, I see you. I'm glad you were able to make it. And I think that probably we will get started. We have over half of you that have registered or online now. So we'll go ahead and get started, because a lot of what I'm going to talk about, you may have questions, and as people get online, they'll ask the questions. So let's get started. So today we're going to talk about peptides and weight loss. And backing up just a minute, I'm Dr. Wallace, if you don't know who I am. There are 7 of us doctors at Desert Wellness Center, and we are all working with the peptides in the weight loss program. So I just happen to be the lucky one to tell you all about it. So we're going to get started. And one of the things that I think is most important to understand before we even go any further is that we all believe at our practice that weight loss is a lifestyle. It is a life change. When you get in the groove, when you figure out what works best for you and you find that ideal body weight for you, it's not hard to maintain it. For many of us, things just kind of get out of control, or our hormones get out of control, life gets out of control. We stop kind of paying attention and being mindful about what we're eating and how often we're exercising and how much water we're drinking and how much we're sleeping, it's hard to keep track of all that stuff. So we lose track. And when we lose track, our weight can get out of control, I guess, with like the rest of our lives. And our body's like, oh, okay, let's store that fat. Let's do this. Let's store that. And it's now at a place where it needs some changes. So when I talk about a lot of weight loss programs, I'm talking about getting you back on the right track. So semaglutide, or the peptide we're talking about today, which is semaglutide, is definitely a way to get yourself back on the right track. And it has some other really cool qualities to it that are also very beneficial to your health. So let's get started. So this kind of talks a little bit about what I just said, and that is everybody's going on diet. 45 million Americans go on diets once a year. 45 million, that's a lot. There's a lot of people. I will tell you that if you ask anybody out there, you walk past 3 people, 2 of them are on some sort of quote diet. And in any given year, those dieters spend $33 billion on weight loss products. So, I mean, that's a lot. We could be going on a lot of vacations if we didn't spend all our money on weight loss programs. So it's let's get it done and let's just make it happen. There really are diets, and I always used to tell patients or clients or whoever when I was a health educator, the first 3 letters, diet or die. And I don't mean that like in a negative, like you're going to die, but I mean that in a way like that's how we look at it. And they're not maintainable. What we're talking about today is something to get you started on a new lifestyle, get you started on a plan that's going to be healthy for you and that's going to keep you at an ideal weight for you. Like I said, those treatment goals always should be to provide longer lasting results. And we always look to what are the underlying causes of the weight gain too, which is what we do all the time here. You know, if your hormones are out of balance, or if you're insulin resistant, or you have some other underlying factors that are affecting your weight negatively, we have to fix those first, and then we move forward. That's the nice thing about when we're talking today about semaglutide in general, is because it helps with that insulin resistance and some other things. So the root cause, like I said, about weight gain, or the root cause of not being able to control your weight, usually lies in many different things. And I mentioned already the hormonal changes, but it also lies in the fact that maybe we got too busy and we're not exercising enough. Or maybe we spend a little bit too much time eating when we're sad, bored, happy. I mean, any reason out there is a reason to eat. That's emotional eating. It's not intuitive eating, which is something I'm a big fan of, which I'll talk about later. But it's emotional eating. It's eating because we feel like we're not paying attention to our hunger cues. Sometimes it's genetics. If you have one parent that is obese or over 30% of their BMI, then you are almost 40% likely to have that same body shape. If 2 of them are that way, might be 80% like. Genetics are a factor. We can work with that, but genetics do matter. And maybe you're not doing the right kind of exercise. Also something we're going to address in our bigger program with semaglutide. And then finally, those metabolic changes. Metabolic changes are occurring every day and as we age. So our liver doesn't work as well as it used to. Pancreas doesn't work as well as it used to. Our gut is not digesting food as well as it used to. All of those things affect our weight. That little, what we call the muffin or the donut or whatever you want to call it, around the waistline as we age is common in everybody because our bodies change physiologically, metabolically slow down. So those are the things that we have to identify and start to change. And when we use peptides, it does kind of work towards changing that root cause. The metabolic changes that I discussed are what semaglutide really and the peptides get at. Like I mentioned, we talked about those insulin resistance or the elevated blood sugar. And just for a minute, sit back and think, whether or not you're a patient at our practice, have you been to your physician or had labs done, and all of a sudden, like, your lipids are elevated? That's your cholesterol. or your triglycerides, which are part of that lipid profile, are elevated. You're like, what? That's not me. That never happens to me. What's happening? Or all of a sudden your blood pressure is elevated. I know that many of the patients that come into my office over the age of 40 have already been talked to by family physicians saying, oh, we're going to have to put you on cholesterol medication. We're going to have to put you on blood pressure medication. And then you start to panic. You're like, no. I have to go and figure this out because I don't want to be on those medications. And good for you. We don't want you on those medications. But a lot of times those metabolic changes are contributing to the elevated blood pressure, the elevated glucose, and the elevated lipids, and also contributing to your extra weight. The fact that you've tried everything and you're still 10 pounds heavier than you used to be, 15 pounds heavier than you used to be, 20 or even 50 pounds more than you used to be. That's telling us we're having metabolic changes. Those are all clues to tell us, hey, our metabolism is changing and we have to do something about it. So by changing the metabolism, now you'll get, and your behavior, but mostly underlying cause, if it's a metabolic situation, we have to change the metabolism, get it back to kind of where it was. Overall, we'll lose weight. And the best thing about it is we'll have improvement in your health, just generally, top to bottom, which is what we're looking for. So let's talk a little bit about what a peptide is. So if you're a science nerd like me, you can really get into this. And if you want more time, you can look at it a little further. But a peptide is basically a piece of a protein. So proteins are made up of amino acids, and they're linked by peptide bonds, and they make these proteins in our bodies. If we break those proteins down, we get amino acids. If we look at a little piece of amino acids together, that family is called a peptide. And our body uses proteins and pieces of proteins, peptides, and amino acids to function in every way imaginable. Especially if you're somebody that's been into our practice and maybe you've been in looking for ways to sleep better, let's say. And sleeping better sometimes requires the amino acid called L-theanine, which is going to calm you down. So an amino acid is just a tiny, tiny piece of a peptide. Together, it's a protein. And together, those are naturally occurring in our body to help all the metabolic functions. So it's really, really amazing to be able to identify these pieces that can help our body work better. The pieces called peptides or amino acids that are building blocks in our body. And all that does is help our body function better. It gives our body what it needs to work better. It's not a pharmaceutical. Like, it's not something foreign to your body, if that makes sense. It's something that more bioidentical. And those of you that have used bioidentical hormones or thyroid replacement, that's what I'm talking about. It's something that your body recognizes. And that's really, really important for the long term safety, for the long term in terms of doing your body good and almost enhancing your bodily functions. So GLP-1 stands for glucagon like peptide 1. It's a fancy name for what we're going to talk about specifically today. It's a natural peptide, so it's a piece, a couple amino acids pushed together with some peptide bonds, and it's naturally produced by your body. So it's naturally produced and secreted in your gut. And its job, it's triggered when you eat, and its job is to tell your body to release insulin into the system to digest your food, and also to slow down any release of extra glucagon in your liver, and that's sugar. So think, when I say the word glucose, glucagon, and glycogen, any of that, it's like sugar, just say sugar. So it stops the liver from releasing any extra sugars into the system that would give you more energy. So basically, I'm going to eat some piece of food. Let's say I eat anything. Doesn't even matter, because everything has some form of sugar in it, even something like a piece of chicken. So we're going to eat that. As soon as I eat it, the GLP-1 is produced in my body and says, we need to release insulin so we can digest this food. Okay, release it. And whew, yeah, we have glucose now. Insulin's coming in. We don't need any extra sugar released into the system. We have it because we just ate the chicken or the rice or the veggies or donut, anything. It should stop the liver from releasing. And when everything's working right, this is perfect because now we've eaten, we are satiated, so our appetite is gone because we're full, and now we feel better. So it works all in conjunction with the body to help us feel better and to digest our food better. Semiglutide is a GLP-1 agonist, which means that it's similar to the actual GLP that's in your body. So when we present that to the digestive system, it looks and acts just like our natural GLP-1 and creates the perfect environment for weight loss. Because now you are taking in food, and if you have extra GLP-1, if your GLP-1 or your glucagon-like peptide being in the form of semaglutide is in the body, you're going to release more insulin. You're going to stop the release of sugar. You're not going to be as hungry. You're going to feel satiated, and you will naturally begin to lose weight for that reason. Because if one of the reasons you're not losing weight is because you are insulin resistant, in other words, your body is not producing insulin like it's supposed to, which happens a lot as we get older, or you're not losing weight because your liver is not listening to your body, is releasing too much sugar into the system. If any of those are the reasons, or if you're just eating because you're an emotional eater, or eating even when you're not hungry, or eating when you're feeling hungry, then this is going to be good for you. So the endocrinologists and people that work in the field of diabetes every day, all the time, have known this fact. They know that's what GLP-1 does. And they also know that semaglutide will help reduce the blood sugar and a side effect of that's going to be weight loss. And so this semaglutide was originally packaged and sold under the name Ozempic, also Wegovy. So most of you, if you are on maybe even social media or whatever, you've heard that many people are using it under the name, and that this is the pharmaceutical trade name, Wegovy and Ozempic, to lose weight, because Wegovy specifically was FDA approved for weight loss in 2021. So the challenge is getting it. The challenge has been, I've had patients ask me, can I get Wegovy? Can I get Ozempic? Because it'll help me lose weight. And the answer is yes, it will help you lose weight. But the more complicated thing is, first of all, if you don't have a diabetes diagnosis, you don't want it because it's not an ideal thing to have. But if you don't have it, you're never going to get it covered by insurance. And on the market, it's been up to $900 to get this covered. So not an ideal thing for any of us, I would say. But the good news is that semaglutide can be prescribed and picked up and utilized by the compounding pharmacies. So we don't have to use the brand name. We don't have to use that pharmaceutical. So that's what we've been doing. So remember, if I just to kind of rehash this, and just to make sure you understand how the semaglutide is working, it's going to delay how quickly our stomach digests food, so it makes you feel full. It slows the intestines and the motility, so it just kind of slows everything down, so you feel fuller longer. It's going to lower your blood sugar because it's sending more insulin into the system, and it's going to reduce the production of sugar in the liver. It stimulates that insulin secretion in the pancreas, by the pancreas. So basically, it's just helping your body work better metabolically, which will lead to weight loss in the end. The really amazing thing about semaglutide, as a naturopath, and I would hope as any other physician, but for us, what we think is really important about it is there's other benefits. There's other benefits like it's going to help the pancreas actually be healthier. It helps those B cells get bigger. We want that. because the pancreas over time gets really tired, and that's where we get some insulin resistance problems. It also helps the brain. It helps that brain actually curb cravings and helps you feel full faster. But it also does not stop any energy levels. All of my patients that have used the semaglutide so far have felt that their energy and the metabolism actually is better, because now your muscle cells are more sensitive to the insulin and the cells work better. So you don't have to slow down. You're not going to feel tired when you use semaglutide. You're going to be able to exercise. However, I usually do encourage the exercise be not like hardcore Orange Theory type exercise. I like to see more of a balanced workout program using weights and using a more functional functional workout. And I had a really important question by one of our patients just asked, if I'm pre-diabetic, can I use this? The answer to that is absolutely. Like, this is the answer if you have an elevated hemoglobin A1C. Because if you have been told by a physician that you are pre-diabetic, or you have your blood sugar is elevated and the hemoglobin A1C has been elevated, this is the way to do it, because it will benefit your pancreas. It will decrease your blood sugar overall. Cardiovascularly, in diabetes, we have renal issues, the kidney suffers, the heart suffers. So the semaglutide actually helps reduce inflammation, balances the lipids, and can decrease blood pressure. So remember back to that slide where I was talking about increased blood pressure and blood sugar and decreasing and lipids. Semaglutide is going to help decrease all of those things. And remember, with weight loss, you get an improvement in all those things metabolic that we've discussed. So the best way that you can lose weight using semaglutide is not to get it online. I'm just going to say that right now. Just like anything else, it needs to be monitored. We are finding, and we're rolling our semaglutide program out after having a few patients on it for the last 3 months, because it really and some of our doctors as well trying it. It's really important to us that this be part of an overall program, because if it's not, then what makes it any different than anything else that's ever come out in the market since the late 80s, since I've been in health education, wellness, and now naturopathic medicine? Because let me tell you, I've seen it all. I have seen it all. And I'm not going to deny or say that I hadn't tried it, because I'll tell you one thing, the Herbalife back in the 80s, oh my word, made me so sick. So there's a lot out there, and doing it right makes a difference. So what's the best way to do semaglutide and make it last? They're weekly injections. Now, we can do a troche, which is a lozenge, but it's better to do the injections. So they're weekly injections that are titrated up slowly. So we watch your doses. You start out low and you move up. The biggest reason for that is because there are some side effects. And as soon as you slow down digestion, you may experience a feeling of kind of like nausea or even reflux. I'm not going to lie about that, because it's a thing. It happens. And the next thing is to just teach and change your way of thinking about food. I love, like I said, the intuitive eating. So many of us don't do it because we've been trying to lose weight and manage what we eat our whole lives. And, we eat at a certain time, we drink at a certain time, and we don't listen to our bodily cues. This gives you a chance to listen to your cues. You won't be hungry. And in many cases, it's better to stop when you're full and not eat when you're not too hungry. But sometimes with using semaglutide, you have to eat a little bit to keep you energized, like keep your nutrition up. So we will make suggestions on what that is. And that's a very good point somebody made. Isn't slow motility a bad thing in the intestinal tract? So those of you especially that have seen us and been with us for a while, we've talked about things like SIBO, or things that are created, and that's an intestinal overgrowth of bacteria when you have slow motility. in the gut. Slowing your motility down all the time, or because there's bacteria in there, that's not a good thing. But this is not slowing it down like that. So your bowel movements remain the same and should remain the same. It slows it down enough so that we can have some insulin, so that your body can recognize that there's food there, and so that the insulin can be released. It doesn't slow it down so much that you have problems. So it's true, and if somebody that's well educated, especially in what the things that we do, you hear the word slow motility, you go, oh, that's not good. But it's not slow motility in a negative way. It's definitely in a way that helps your body just absorb better, if you will. You can continue your exercise program when you use semaglutide, because you still have nutrition, and we still want you to exercise, and you still have energy. And then this is slow weight loss. This isn't like, I'm going on a trip in 3 weeks and I have to lose weight. That's not good. And we know everybody does it, but that's not what this is. It's a 1 to 1.5 pound weight loss a week. So that's 4 to 6 pounds a month. And honestly, that's what I've been seeing in my patients. I have seen success in the last 3 months with several of my patients. I've seen that pretty typical 6 pound weight loss, and then maybe another 6 pound weight loss, and then maybe a 4 pound weight loss. Over 3 months, I've seen about an average of the 20 pounds, 15 to 20 pounds, people that have stayed with it, increase the dosing properly, listen to the cues, eat healthy food, continue with exercise. It does really require at least a 3-month commitment, and for many people, 6 months. And, one of the questions asking about if you're diabetic, it won't work for you. That's not true. This still will work for you if you're dealing with a type 2 diabetes. Now, if you are on several other diabetes medications, we need to just talk about that. We need to make sure this is the right thing for you, but it still should and could work depending on what other medications you're already on. Anyway, commitment, that last point is important. So these are the things to consider before you start a program with semaglutide as the helper. When your digestive slows down, like I said, there's some side effects. There can be nausea. There could be some, I haven't had anybody really, oh, no, that's not true. I have had one of my patients that did actually vomit, diarrhea, constipation, maybe some reflux. It can happen. I'm not going to tell you it's not going to happen, but we manage it. We've been able to manage, and it hasn't been horrible for most of my patients. We can use things that are pharmaceutical, like Zofran, things for nausea. We can also use natural things like DGL. We use that a lot with our patients, and I have found that works really well. So there's some things to consider. There are some side effects. I will tell you that when you are using semaglutide, your body will react negatively to sugars, to too much alcohol, and to high-fat foods. So it does start to train you and your mind about what are those ideal foods to eat. And I will say that helps with some behavior change, and it does help with some intuitive eating too. It's not recommended for people that have had endocrine cancers and pancreatitis, some of those serious other things that we could discuss individually if you wanted to. And you can take, it doesn't interfere with any of your other medications, supplements. We have not seen any contraindications in terms of any pharmaceuticals or other things that you might be on. And I have only had one patient in probably 15 or so that I have starting this that said, I'm not doing this. I can't. I don't want to do it. I have too many side effects. So, and overall, it's about 5% of people discontinue because of those side effects. But remember, every program's not for everybody. And like I said, we can deal with those side effects. One of the things we noticed was doing an injection at nighttime is better than doing it in the morning. So your injections are once a week. So if you do your weekly injection at nighttime, and I think that Sunday nights work better because most of us are less tempted during the week to eat some of those things that are not a good choice. So if you do it like on a Sunday night, it might not be a bad option. Then, making we mostly make pretty good choices when we're working during the week. That might be a good idea. But the nighttime injections helped a lot with the reflux and nausea. So we have some of these little clinical pearls or hacks, whatever you want to say. And those are easily dealt with. And I had a question or a comment. Are these side effects similar to those experienced intermittent fasting? I don't know. I haven't seen a lot of these side effects in intermittent fasting, other than some people get hungry when they're intermittent fasting or dizzy. That's not something I see with semaglutide. Semaglutide, I see more of a reflux. That's probably the most common side effect. And also, that side effect is more common when eating something like the sugar or anything like that. I will tell you, one question is, does it affect your liver? And the answer is yes, it affects your liver in a positive way. It will regulate the liver, its release of glucagon and its release of sugars into the system. Now, anytime your liver is forced to work, it's not happy. So if you've ever been seen in our offices or anywhere else, I say, oh, if your liver enzymes are elevated, what's going on? And many times it's like, okay, well, how many drinks are you having a week? You go right to the alcohol. But other things affect your liver function. My point is that when your liver is working hard, let's just take the alcohol example because it's easy. Lots of drinking a lot of alcohol, liver has to overwork, enzymes go up. In this case, if you're helping it out with semaglutide, it's not having to work as hard. It's better for your liver. So in the end, we should see liver enzymes decrease with the use of the semaglutide. That's a good thing. So let's look at our ideal candidate for semaglutide. If you're wondering, well, I'm my ideal candidate, because a lot of you are, you're looking for a long-term weight loss plan. You're looking for something that's going to get you started on the right path. And the other thing is, it's somebody that, and the initial patients I started on semaglutide were the ones that are like, look, I eat a healthy diet. I exercise regularly. I'm balancing my hormones with you. My thyroid is in check. Like check. I'm doing everything right. What's happening? Why is this not working? And that is the person I've started with. Those are the people that have definitely seen success. And and most of those patients are at least over 15 pounds. We need to lose more than 15 pounds, 20 pounds or more. That's kind of the minimum. That's what we want to see. Up to needing to lose 100 pounds or more. So that's kind of the ideal place, long term. Now, if you're okay with losing that 10 to 15% of your body weight, 1 to 1.5 pounds a week, and you don't want to limit exercise. So we do HCG here, and I like it for certain people for certain reasons. That's a good plan, but you can't exercise, and you can't exercise on the program, and we want you to exercise. I'm giggling because in the chat, so many of you will be like, that's me, you just talked about me, especially when I see my patients saying, that's me. I know it's you. We'll talk, promise. But I love that you don't have to limit exercise, because those of you that either have seen my social media, know me, or are my doctor, or I'm your doctor, know the exercise kind of is my thing. Like, I love it. I've loved it my whole life. I love everything about it, and I can talk about, I can give Lululemon a little pitch here since I represent them, but it's a thing. It's important. It's important for your mental health. It's important for everything. And if we can take time to change your body weight and still exercise, I mean, to me, that's a win for sure. You have to be willing to limit your sugars and excess fat, because that's going to help you be successful, because you're not going to have as many side effects. I mean, it's kind of like the old adage when people used to carry Tums around in their bags, and they used to take Tums like candy, eat Tums like candy all the time. Well, duh. If you're having to take Tums like candy, something else is going on. It's something like if you have to take Advil all the time because you have a pain, how about we figure out why you have a pain? Let's just figure that out. So if you're willing to limit the excess sugars and fat, then this might be for you. And then again, weight loss goal of 15 pounds or more. That definitely, I will stick to that. So let's look at our program. And we're getting close to the end of the webinar. This is our last slide. So if you have more questions, then I will put them in the chat and I'm going to answer them because that's going to talk about your program. And one question, do you have to come into the office for the injections or can you do it yourself? So let's talk about that. You can do them yourself. Part of the program we're putting together with Semiglutide, you will come into the office and get 4 injections and take them home. You will inject yourself for 1 month, and then when you come back, you'll get your next set of injections. Very simple to do. It just goes in the abdominal fat. And I tell people it's like a Botox needle. So it's simple, 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 and you can't feel it. When you have experienced any kind of little pinch, 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 that's all the shot feels like. And it doesn't even have to reach down around to your booty like a B12, just in the front, so it's easy. When we start out on our program, your initial visit with your doctor is going to be 30 to 45 minutes, depending on how much you already know about the program. And then you're going to meet with one of our amazing MAs, who you all know and love, and they're going to go through meal planning, the injections, how to do them. They'll give you your injections, and we're going to do body composition. So we're going to do a body composition with you before, at the first, and at the end of 3 months, because our program is the minimal amount is going to be 3 months. The ideal amount is probably going to be 6 months for most of you. And then some of you, it'll be a year. And if you already are experiencing insulin resistance to the point where you have an elevated hemoglobin A1C, this may be something you always do. We will visit that in an individual basis. But you will get in the first month, and one of our MAs will call you weekly to check in. I think this is super important. And remember, we put this program together after running Semaglutide through some of our patients. And this is what we have learned to help you be more successful. And that is, you're going to get the most changes and side effects probably in the first month. So we want to check in on you weekly. And we want to be able to adjust your dose, even though there's a titration or a dose change that's kind of standard, if you will. Well, nothing in naturopathic medicine is standard, because none of you are standard. You're all special. We're all special. We're all different. So we are going to adjust those doses as needed, based on how you feel, based on how your weight loss is. We will definitely make changes based on that. So we will also do a Metabolic B Shot, and I think that's an important part of the program too. So after your first month, then you will come in. We will meet with one of the MAs for 15 minutes, and then you'll meet with your doctor again for 15 minutes at the end, so that we can make our adjustments and our increases for the next month. So we will do that body composition every 3 months. You'll get the Semiglutide injections, you'll get your B12 injections, and the meal plan and the booklet that goes with it. So this, we think, is a good way to do Semiglutide. It is the way to ensure that you will have long-term success, and to ensure that it will be safe. So this is the best way we feel to do the program now, or to do Semaglutide. There's an option to do month to month, but we feel like doing at least 3 months commitment is the best way to do it. And I do have a question, of course, already. How much is it going to cost? So we want to make sure, we would love to talk to you about that, but we think you need to just give us a quick call and we'll talk to you about that. Everybody at the front's ready to go to talk to you. But the important thing is that you get 10% off your first package. Your package, if you do it before the end of March, because it's part of our winter specials, which is pretty convenient, I think. But it's definitely the way to go in terms of just doing the program instead of just doing that. Somebody is asking, what happens if you start and then you stop? You'll probably gain the weight back if you start it and stop it and don't make any changes. If you start it and go at least the 3 months, make some lifestyle changes, discover where you're making mistakes in terms of your weight management, then stopping, some people decide to taper off, but the Semaglutide stays in your system for a couple of weeks. So once you stop taking an injection, it will last for a little bit, but I like to taper it. So if you're at a certain dose and you're like, I've lost the weight that I want to lose, then I'll be like, okay, perfect. Let's go another month and take you down a notch, and then continue to be mindful of your eating, continue your exercise, continue to do all the things that you've done to make yourself successful so far, and you will continue your success. If you are, there's a question about labs, and most of you are part of our practice, and so we will monitor your labs like we normally do. If you're not part of our practice, then we can take labs, send in a lab order, and monitor you before we begin, and then again at the end. I think it's amazing and a good thing to monitor your labs, because guess what's going to happen? Your A1C will eventually go down. Your blood sugar eventually will go down. You will see improvement in your labs, which I think is another reason to continue with your lifestyle changes. Because of course it's very, I don't know, it's definitely positive reinforcement when you're losing weight, but it's positive reinforcement in the end to know that your body is going through some major changes and that they're positive changes. So what other questions do you have as we go through this? Obviously, calling and getting more information is the best thing to do if you are interested. And, you know, meeting with your doctor. If you already have a doctor here, then that's the doctor you will probably work with. If you don't already have a doctor here, then we'll set you up with somebody. And that first appointment might be like an hour instead of 45 minutes. We are going to base that first appointment on if you already have knowledge about semaglutide or how much information you really need. What somebody was asking, can it or will it make you hypoglycemic? And the answer to that question is yes, it can, if you're not eating. So let's say you get to the point where you're really not hungry at all, and so you're like, I'm just not going to eat at all. Okay, well, that's not good. We do advocate, like, protein shakes are a really good option in this program, but that's why we give you a list of foods that's good to eat, a list of foods that's good to avoid. We will give you a plan, and that will definitely help. You don't necessarily need B12 shots, but B12 always helps with metabolism. So we thought we're going to put B12 into our program because it will definitely help you with your energy levels. And I mean, obviously your calorie intake is going to be lower. And when you have B12, in that case, B12 is definitely going to help you. You can get access to this webinar just because you've registered. So we'll send you the link within the next 24 hours. So you can watch it anytime you want, and the slides will be on there. If you specifically want the slide program, why don't you just give us a call and contact me otherwise personally. If men and women, who is more susceptible, or if anybody is more susceptible to side effects, I have to say I don't know the answer to that question. I haven't seen it too much one way or the other. It really is unique. It's unique to you. I also see side effects. Here's one trend I am seeing. I see the side effects, the reflux, happen really in the very beginning, and then it lessens up through that first month. And then every time there's a dose change, I will see some side effects. So at a dose change. And now the other thing we see is we'll get to a certain dose and we're like, okay, I'm feeling good. I don't have any side effects and I'm still losing weight. And I'll be like, okay, why don't we just stay there? And we still get the same amount of weight loss. So not everybody gets to certain dosages. And that's what the monitoring is all about for us in the program. We want to monitor you and how you're reacting so that you get the best outcome. Excellent questions. I can tell you're paying attention. Any other questions before we go? Nothing? Are you all just like, okay, I'm going to call first so that everybody is not calling at one time? I truly, again, just to kind of wrap up, I truly believe that, we all need a jump start every now and then, and we have a lot of ways to do that. We have a 5-day detox program for Prolon. We have a 14-day program, our Designs for Health program. We have HCG. This is just basically another tool for the toolbox in terms of weight loss and basically lifestyle change to keep our weight where it should be or where it needs to be. We all have a different place that we need our weight to be in, and this kind of gives us the opportunity to find that place for us. And again, if you need more information on the pricing and the specifics beyond this of programs, just call our front office and they will definitely get you pointed into the right direction. You guys are awesome. There were a lot of you on this call. Thank you so much for listening. Thank you so much for watching. Please let us know if you have any more questions by calling the front office and getting you all set up. I know you will be successful. So I will see you all soon. Thank you.